This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the journal Einstein, Sao Paulo, Brazil, published in 2026. It's a randomized clinical trial titled Evaluation of the Effects of Plasma-Lyte 148, or 0.9% saline, on acid-base balance in patients undergoing neurosurgery.
This is a topic that hits home for anyone who spends their days in the OR. We often think of fluid management as the domain of our anesthesia colleagues, but as neurosurgeons, we know that the choice of crystalloid solution considerably affects perioperative outcomes in our patients. It's not just about volume, it's about the chemistry of that volume.
Exactly, Dr. Aris. The study specifically aimed to evaluate the effects of Plasma-Lyte 148 and 0.9% saline on both acid-base and hydroelectrolyte balance. They focused on a specific demographic, adults undergoing elective neurosurgical procedures.
Now, for the residents listening, let's set the stage. When we talk about 0.9% saline, we're talking about a solution that is relatively unphysiological in terms of chloride content. Plasma-Lyte 148, on the other hand, is a buffered, balanced crystalloid. Ilara, why is this distinction particularly critical in a neurosurgical context?
Well, according to the focus of this trial, it's all about maintaining stability. In neurosurgery, we're often managing patients where even slight shifts in acid-base status can complicate the clinical picture. The study highlights that the choice between these two fluids can have a significant impact on the patient's hydroelectrolyte balance during and after the procedure. If we see a shift toward acidosis, it can affect everything from coagulation to cerebral blood flow.
Right. And in elective neurosurgery, we have the luxury, if you want to call it that, of planning our interventions. These aren't always trauma cases where you're grabbing whatever is on the shelf. We want to optimize the internal environment. When this study looked at these adults, what were the primary parameters they were measuring?
They were looking very closely at the acid-base balance, so pH, bicarbonate levels, and base excess, and the hydroelectrolyte balance, which includes our major ions like sodium and chloride. The randomized nature of this trial is key here. It allows us to see if Plasma-Lyte 148 truly offers a more stable profile compared to the standard 0.9% saline we've used for decades.
And for the medical students tuning in, remember that 0.9% saline is often associated with hyperchloremic metabolic acidosis. In a long neurosurgical case, say a complex tumor resection or a deep vascular malformation, you might be giving several liters of fluid. If you're using saline, you're dumping a lot of chloride into the system.
That's a great point. The study emphasizes that the, quote, choice of crystalloid solution considerably affects those outcomes. If the study shows that Plasma-Lyte 148 maintains a more neutral acid-base balance, it suggests we might be able to avoid some of those iatrogenic disturbances.
Let's dive deeper into the hydroelectrolyte balance aspect mentioned in the paper. In neurosurgery, we are obsessed with sodium. Why? Because of cerebral edema. If our fluid choice leads to significant shifts in serum osmolarity or sodium levels, we're potentially affecting brain relaxation and intracranial pressure.
Precisely. While the paper focuses on the broader elective neurosurgical population, the takeaway is that Plasma-Lyte 148 is designed to mimic human plasma more closely than saline does. By evaluating these effects through a randomized clinical trial, the authors are giving us a higher level of evidence to justify using these balanced solutions, even though they are generally more expensive than standard saline.
It's about the value of the outcome, not just the cost of the bag. If we keep the acid-base balance stable, we might see fewer metabolic complications postoperatively in the ICU.
And since this was published in Einstein in 2026, it reflects a growing global consensus in neuroanesthesia and neurosurgery that normal saline might not be so normal for the brain.
Very true. So to wrap up the key takeaways for our colleagues, this was a randomized trial in adults undergoing elective neurosurgery. It compared Plasma-Lyte 148, 2.9% saline, focusing on acid-base and hydroelectrolyte balance.
And the main message is that our choice of fluid is a deliberate clinical decision that impacts the perioperative environment. We should be mindful of how these solutions alter our patient's physiology.
Excellent summary, Dr. Alara. That's all for today's episode of the Neurosurgery Hub podcast.
Thanks for listening. We'll see you in the next one.